So I think all of you probably know by now how passionate I am about managing pain, not only in terms of perioperatively around the time of any procedure I do, because I want to have almost no pain, and I really have very minimal pain, but I also want to manage any kind of level of discomfort for patients that are having chronic issues. As you probably also know, I've invented a technique for TMJ pain that is quite unique. And I also want to share with you some thoughts about it because, you know, when I ask a lot of my patients, do you have TMJ? They say, I don't have that. And then I say, well, I go and touch this area. I go, yeah, that's tender. I go, you have TMJ. And it's funny because I can see across the room someone with TMJ. It's a facial shape. It's not just the fact that they have huge masseters, but there's something about the face. I've done this for 20 years. I have pattern recognition. So I think I'd rather phrase it instead of do you have TMJ or temporal mandibular joint issues, do you have facial tension? Do you hold facial tension? And it's a better way to conceptualize, I think, what's going on because there's such a huge majority of my patients, I look at them and they go, no, I don't have TMJ. And then I touch the face and go, no, I'm tender there. I have a little tenderness there. And I know they have it. And once I do the treatment with my release, because the type of Botox release I do with TMJ is instant relaxation. It's not 2 weeks later they get a little bit of improvement. And it doesn't change the facial shape, whether you like it or not. I use the other method for that, the traditional way of masseteric injections. But there is an instant release of discomfort. There's an instant relaxation. So I think a question that I should be asking my patients are, do you hold facial tension? Do you hold tension in your jaw? Do you hold tension in your face? And when the answer is yes, I know I can help that person with instant results where they get much better sleep, dental protection, everything, their stress level goes down. So I think I'm going to start asking this question, but a question that I probably want to ask you is, are you having any facial tension? Not do you have TMJ, not do you have clicking and popping, not is your masseter big, not do you grind your teeth. Not everyone will tell me that, but they clench, they hold their facial tension. I think our subconscious has a better ability to understand this question, and I think the answer to a lot of you out there is probably a yes.